When I was applying, I looked into schools in the US because my primary reason was to get out of Kenya and experience a new culture. So Hofstra is the school that really gave me that opportunity in terms of different aspects. Financially, the process was very easy to apply. It was the first school I got accepted into. I feel like they really welcomed me into this school, so that's why I chose to come to Hofstra. From high school, I always knew that I wanted to work in the health field. And I came to the US and I knew the process was a little different from my country, where you had to do 4 years of pre-med and then go on to med school. So I wanted to choose a major that would give me a good grounding in public health and in the health sciences, and also the basic science requirement I needed. So after evaluating with the different choices I had, I feel like health science was my best option because it gave me a broad understanding of what it means to be healthy and what the health system in America looks like. And Kenya, college is mostly books. That's what I thought I would be coming to do, is all, study, spend 24/7 in the library. So I didn't really think about anything other than the classroom experience. But what surprised me at Hofstra was the amount of, outside of the classroom learning that, I had, the internships I did, the interaction with professors, with other students, just being able to be modeled into a student who's not only excelling in the classroom but outside the classroom. I was fortunate to have 3 different internships, one at Long Island Jewish Hospital, one at North Shore University Hospital, and one out of state in an organization called Management Sciences for Health. So all this experiences really, built into my whole college career, and gave me skills that I would not necessarily get from the classroom. I took an internship which I really enjoyed in clinical research, and I decided to take a year off and actually do clinical research, and build up on my clinical side of medicine. I would say my main club was the Red Cross Club, which I actually founded with a couple of other people. So I served as a president for about 3 semesters before I handed over to someone else who took over the club. But it's an initiative that came from my experience in Kenya. My summer after my freshman year, I went back to Kenya and I was able to work with the Red Cross doing different activities. So I really liked what I did and decided to start a club here on campus after corresponding with the local NASA office. And we were able to do so many things, fundraisings, just creating awareness about disaster preparedness. So I really enjoyed that. The School of Health is unique in that it has a diverse student population who are interested in going to various areas of health. Let's say occupational therapy. We have students who want to go into nursing. We have students who want to go into medicine, into dentistry. So having such a diverse student group, brings to the table a lot of quality, feedback, in terms of classroom discussion. They really take care of the students to make sure that you're on track with your academic schedule, that you get the internships you need to graduate, to get the placement for jobs if need be, if you need to do a job after you graduate. And the classrooms are small and intimate, and you get to know each other. The professors are phenomenal. They're experts in their field. They really teach you, the material as well as, other current events, to keep you up to date with what's going with the healthcare. It's a very dynamic field, and the professors are really great at interacting with the students and making sure you're on track with everything. Hofstra has really prepared me to go into medicine in terms of the academic preparation, in terms of the outside of the classroom experiences. My internships have given me exposure to clinical medicine, to patient interaction. So I feel prepared and ready to apply and go into medicine and be successful at it. And so I look forward to going on into medicine and always knowing that Hofstra made me into who I am today in terms of my eagerness to go into medicine.